right. Which of the following is most appropriate recommendation for this patient to help slow down the progression of her condition? 35-year-old woman presents to the ophthalmology clinic with history of progressive night blindness and difficulty with peripheral vision. Her father had similar symptoms. Fundoscopy reveals bone spicule-like pigmentation of the retinal periphery, retinal arterial attenuation, and waxy pallor of the optic discs. Genetic testing confirms the diagnosis retinitis pigmentosa. I do not remember this condition. However, we kind of talked about this a little bit before. My initial gut, without even looking at all the answers, was like, okay, progressive night blindness, peripheral vitamin A.
Okay.
Or wait, was it vitamin E? Is it vitamin E? Wait, maybe I was thinking vitamin E. Okay. I might have been because that's tretinoin. I don't think that's going to. I was thinking vitamin E, so maybe that's not it. Um, Retinitis pigmentosa. Let's see. Bone spicule-like pigmentation. None of this is ringing a bell too much. Is maybe that photocoag? I'm not sure. I mean, you're just trying to slow down the progression of the disease.
Okay.
So,
Good.
that's a little extreme. Um, that's why supplementation makes a little sense here.
Okay.
It's either that, I would go pretty conservative with this. So either severe night blindness, difficulty periphery. It might be the vitamin because the regular use of oral corticosteroids, I don't know if that's going to help over a long period of time with this. I don't know. So yeah, this is a guess though. This is a guess.
Yeah.
Okay.
So
All right.
good. So first thing is retinitis pigmentosa. You have to know that it's untreatable, right? You cannot cure
Okay.
this. Okay, we don't have a cure for this. I had a friend that had this. Kind of sucks. It's just like a degenerate.
Oh
Like,
no.
yeah, over time, your retina just dies, right? You can't see light, right? You start going blind.
Whoa.
There's nothing that you can do to cure it as because it's a genetic thing right now, so we don't
Okay.
actually understand how we can fix this. So the only thing, like you said, is kind of conservative management to slow the disease progression. So I know there's a lot of research and trying to figure out how we can cure this, but nothing yet as far as my knowledge. But yeah, so vitamin A can help with can help a little bit with slowing down the progression.
Okay.
Avoiding sunlight, not really proven. Treatment with VEGF, right, is age-related macular degeneration and diabetic retinopathy, like we talked about in the past, but not really for retinitis pigmentosa. Steroid use, right? You're not going to take steroids for the rest of your life, right? And that's going
Right.
to mess up your body in other more ways than
It's
one.
gonna mess, yeah, bone degeneration. You're gonna have like
Exactly.
all the Cushingoid symptoms and stuff like that.
Exactly. Exactly. And photocoagulation therapy, kind of like we talked about before, usually for your wet macular degeneration stuff and diabetic
Okay.
retinopathy and things like that. But
Okay.
yeah, so kind of a sad thing for retinitis pigmentosum, but yeah, we can only, give the supplementation that's good for vision, help it as best as we can with supplementation, but there are no drugs, there are no surgery to kind of fix this right now.
Okay.